Depression in adolescence, I think, is the hardest to identify because it's easy to mistake a teenager's behaviors, acting out, behaving a certain way. We often think that that's just part of puberty and, growing up. And so it's hard to identify that somebody does have depression. If you look at the signs and symptoms that is listed from the book, inappropriately expressed anger, aggressiveness, running away, social withdrawal, substance abuse, sexually acting out, restlessness. I mean, we've all been teenagers before, so I'm sure we've at least expressed some of these signs and symptoms. So the visible manifestation for adolescents experiencing depression is behavior change that lasts for several weeks. For example, a normally outgoing teenager all of a sudden becomes withdrawn or antisocial. They're probably depressed. Or someone who usually gets good grades and is doing good in school all of a sudden turns, to the bad stuff, stops going to school, stops doing their homework. They're probably going through some things and they're probably depressed. Um, and it's a manifestation of the stress and independence conflicts associated with the normal maturation process. Treatments for adolescents depression is usually outpatient and a supportive psychosocial intervention. Fluoxetine is used to treat depression in children and adolescents, but Lexapro is for ages 12 to 17. Although there is a black box warning for these antidepressants, it can increase suicidal thoughts and behaviors while people are on these medications. So closely monitoring children, and especially children and adolescents taking these medications for antidepressants, is very important.